At age 22, Richard Norris took a gunshot to the face. 15 years later, Joshua Aversano was hit by a bus. Aversano's body, face and all, was donated to science. After 36 hours of surgery, Richard Norris's face was reconstructed using the remains of Joshua Aversano. To some, it may seem morbid and creepy. Organ donation is highly stigmatized but much needed in medicinal practices globally. According to the Nebraska Department of Health and Human Services, there are roughly 400 people waiting for an organ donation in Nebraska right now. People around you, some whom you may know well, could be in dire need of an organ transplant. If not now, maybe in the future. Today, we will be discussing the benefits of organ donation. Next, we will talk about the advantages and the reasons why you should donate your body to research or science. Finally, we will explore what it takes to become an organ donor and how to sign yourself up. Let's begin by discussing organ donation. According to the Health Resources and Service Administration, over 109,000 Americans are on the transplant list. Every 9 minutes, another person is added to this list. HRSA also states that 17 Americans die every day waiting for an organ donor. Some people say, well, I consume nothing but energy drinks and Cheez-Its. They don't want my organs. Believe it or not, they still do. There are few things that prevent an organ from being transplanted. The University of Michigan Transplant Center states that HIV, cancer in that particular organ, viruses, and extreme damage caused by extensive drug use or traumatic injury are only a few things that make an organ ineligible. In other words, unless that organ is literally shutting down, you're probably fine. According to the National Center for Biotechnology Information, some people don't sign up to be organ donors because they are afraid it will be sold on the black market without their knowing consent. This is fortunately invalid. In movies such as the 2010 movie Caged, produced by the company Sombrero Films, an organ trafficking victim is kidnapped, locked in a dirty basement, and sedated. The unsanitary environment, unqualified doctor, and insufficient supplies lead to the victim having a painful recovery or even death. But this is extremely rare in the United States. As long as you go through a hospital, you'll probably be fine. The main reason that more Americans aren't organ donors is the lack of trust. Other people believe that most people in need of organ transplants only need them because of the harm they've caused themselves. For example, some refuse to be an organ donor because the person in need was a substance abuse or a convict. Sidney Kimball Medical College states that before former drug addicts are put on the transplant list, they are thoroughly evaluated by a trained substance abuse counselor. The patient undergoes a series of tests, and if the counselor sees that the patient has a greater risk of relapse or is unhealthy, the patient is rejected. It is extremely difficult to get on the transplant list as an abuser. According to the University of Pittsburgh School of Medicine, convicts are also not likely to get organ transplants, depending on the crime and attitude towards becoming a better person. Convicts and felons have little to no chance of getting an organ transplant. Chances are your organ will not be going to a drug user or criminal. We know the benefits of organ donation, but what about whole body donation? Body donation is similar to organ donation in many ways. According to Mayo Clinic, the average body can save up to 8 lives. The organs of a deceased person may still be viable for transplant. The same goes for tissues, muscles, and other body parts. Even if a donated body cannot save another living person, the donation can still be used as a learning tool for med students. In order to test new medical procedures without putting people in harm's way, doctors are able to test implants such as artificial joint replacements without the risks. They can collect tissue samples to research diseases such as Alzheimer's, diabetes, and cancer. Even with the developments of new technology, practicing medicine on, actual humans is crucial. Despite the various options professionals provide, only 20,000 bodies are donated to science each year. That's not many. Many people have a specific burial in mind after death. Whole body donation doesn't really allow some of the traditional benefits, but there are many other options or compromises. The remains can be buried, cremated, or a non-traditional burial at sea. According to the University of Pennsylvania Health System, 95% of Americans are willing to donate, but only 54% are actually registered. When asked why they are not registered, 48% said they simply didn't know how. Many DMVs include organ donation on the basic questionnaire. Apple also includes an organ donation registry through their iPhone Health app. If the iPhone or DMV option doesn't work for you, registering online is an easy 4-step process that only takes 10 minutes. First, go to organdonor.gov/register, then select your state. You will be redirected to the appropriate website, in our case, Live On Nebraska. Next, enter some basic information about yourself, and finally, create a username and password. Boom, you're done. Today, we discussed why you should become an organ donor. Next, we discussed the benefits of donating your body to research. And finally, we discussed how to sign yourself up. If more people were educated on how to register, many lives would be saved. 17 people die every day waiting for an organ transplant. The need for organs, tissues, and bodies for medicinal practices is forever increasing. The next time you see a happy news story about a successful organ transplant, sign yourself up. You could save a life.